welcome to A Collaborative Approach. I'm Meredith Cook, and this is Jill Sakey, and we're really excited to share our new venture with you. About a year ago, Jill and I decided to open a collaborative approach, which was really designed to provide multidisciplinary treatment for all of our clients within the same building or under the same roof. And so now we're really trying to expand all of that to providing collaboration with our supervisees and those we supervise who are either wanting to go for their SEDS or their SED-RD or just their own individual disciplines. And so we really wanted to share more about that with you today.
As Meredith said, my name is Jill Sakey. I'm a registered dietitian, certified eating disorder specialist, and IADEPT approved supervisor. I've been a dietitian for about 20 years, started my career as a clinical dietitian, had a few kids, and then went into weight management. And that's where I was exposed to eating issues, emotional eating, binge eating disorder, but I didn't really know what that was. There was something off there. So I had the opportunity to work in another private practice, and that's where I was exposed to eating disorders, and that's all I saw: anorexia, bulimia, binge eating, those types of things. So I had to do a huge paradigm shift and become a non-diet dietitian. I also had the opportunity to work with an IOP program and partial hospitalization program in Houston as well, and was exposed to the treatment team a little bit more there. But you and I collaborated quite a lot when I was an outpatient, and that's where Meredith and I felt like we connected really well and enjoyed working with you.
Yes.
So I'll let you say a little bit more.
Yeah, absolutely. So again, my name is Meredith Cook, and I'm a therapist. In Texas, I'm a licensed professional counselor. Then also I have my SEDS, and then I'm an IADEPT approved supervisor like Jill. So I began treating eating disorders in 2007. My first job was working as at a residential treatment center as a therapist there, and so I was very quickly introduced into multidisciplinary treatment, and that's kind of my start. And so whenever I transitioned into private practice in 2009 and moved back to Houston and started building up a clientele, and I think we met in 2010, and Jill and I, of course, collaborated and worked really well together, and so just kind of transitioned into there. And then also in private practice, when I worked residential, it was adult women with anorexia and bulimia, and then in private practice, you kind of see a lot more. So I've seen, adolescents, got introduced more to binge eating disorder, emotional eating, have treated a few men, and so it's a little bit more varied. And and then so since having my the IADEPT approved supervisor designation and starting Supervision, I guess a couple of years ago, really kind of noticing some of the questions that come up for our supervisees. And, a lot of the questions kind of revolve around, if you're a therapist, what does a dietitian need from me? And if I'm a dietitian, what does the therapist need from me? And so it just kind of morphed into this idea for us to provide supervision that incorporates both disciplines.
At the same time.
Yeah, absolutely.
Well, when I obtained mine traditionally through IADEPT supervision, I wasn't grandfathered in. I had already had a lot of experience with eating disorders nutritionally and felt pretty confident with it, although I'm still learning, as everyone should. But I had the opportunity to get all of my supervision through a psychologist, and really benefited from that because there was so much. As dietitians, we don't get a lot of background in abnormal psychology or just therapeutic skills, those types of things. So I was able to get a lot of great insight and information that way. So, now as a dietitian and therapist, you have to get about 75% of your hours through the discipline that you're in. And so we thought together that this would be a great opportunity to kind of get both together, as well as see how important it is to collaborate and what that looks like.
Right, absolutely. Because while it's important that each of us practice within our scope as far as treating our clients, we both feel it's important to understand the other disciplines. And for one thing, that's just, you have to be very knowledgeable when you treat eating disorders because they're so complex and so many different facets to it.
Not do each other's job,
yes,
which can easily happen.
Exactly.
And so the more you understand each person's role, the less you step on each other's feet.
Right,
So,
exactly. And also, the kind of the point that I bring it to is, right, like with splitting. I mean, eating disorders just being very complex, and everyone's in a different place in their recovery at any given moment, that a lot of times splitting can really happen with the treatment team. And so I think the more that you understand about other disciplines, the more that you're talking to the other disciplines about the treatment, the more you're able to really provide best patient care for eating disorder treatment. And so we're just really passionate about that, and want to, like, you know, teach others about that and what that looks like. And so in doing this supervision through a collaborative approach, we'll really be talking about a lot of those different things in our field, and just kind of certain nuances and ideas, and how to do all of this where we understand each other, understand roles without stepping on toes.
Yes.
Yeah.
So we look forward to working with you, and I appreciate you giving us a chance to let you know what we do. We have a lot of extensive experience with eating disorders. I know I see probably 100% of I have 5 other dietitians and probably 60 clients a week, and all of them have eating disorders, and I know that's primarily your area too, although you see other things too. So we hope that you can trust us on your journey towards obtaining your certification, and we would love to stand by you during that. Thanks so much for checking us out.